Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. We have a client who attended with bilateral, fully occluding soft earwax. The earwax was extending right from the ear canal entrance all the way to the eardrum, so approximately 2.5 centimetres in depth. The patient is a regular client and has been seeing me since 2016, so almost 5 years. And in the past, when I first started performing clinical ear care, I used to struggle a bit with the patient's ear just because of the consistency of the earwax. So it was very mushy. It was almost like mashed potato, like wet mud, and it would be very hard to suction, and there's always wax stuck on the eardrum. However, I think back in 2017, 2018, I one day decided to put some olive oil drops into the ear during the procedure. So as clinical ear care specialist. So I'll come back to the moment, but this is the patient's left eardrum. That white patch, that's called tympanosclerosis. It's scar tissue on the eardrum. It's calcification, calcium deposits. And that normally occurs secondary to trauma to the eardrum, whether it be barotrauma, so trauma caused by changes in pressure, whether it be air or water, acoustic trauma, so loud sounds, physical trauma, so injury to the eardrum, or also due to chronic ear infection. Yeah, so I think back in 2017, 2018, I decided to one day put olive oil drops into the ear during the procedure. Now, so quite often, clinical ear care specialists advise their patients to put drops in prior to attending, just to soften the wax, to help lubricate it. And this patient did. I did ask that patient to do this on the first couple of occasions prior to attending, but it's still very difficult to remove. So I decided one day to put drops in the ear during the procedure, and it worked a treat. And I always kind of advise that to my delegates as well. So not only can you recommend patients using drops prior to attending the appointment, but you can also use it during the procedure as well, just to, especially olive oil drops, it binds the wax together, it brings it together. I always compare it, if you've been watching my past videos, to an egg in a potato cake or fish cake recipe in a mixture. It binds all these ingredients together, and I find that olive oil drops has that tendency. It doesn't dissolve wax, it doesn't really disperse wax, it just brings it together. So when you're vacuuming, the suction probe doesn't get blocked, the plugs of wax come in large pieces. You can see this wax has been there for a while, and you'll see the eardrum's crystal clear, so there's less tympanosclerosis. There's a bit posteriorly, inferiorly, just a bit of wax near the entrance, just mopping that up. Yeah, so I hope you enjoyed that video, guys. I'm just mopping up around the entrance. If it's the first time you're watching on YouTube, please do feel free to subscribe to the channel, select the bell icon so you'll get notified as and when I upload new videos. Similarly, if you're watching on Facebook or Instagram, please do follow the page. So just a few hairs at the entrance, or just that's how you know we're near the entrance. So just with the suction, just mopping this up right near the entrance. But the patient's symptoms alleviated, you can hear very well indeed. There's just a final view again of the eardrum. There's some dead skin at the top, just mopping that up. And in a moment we weighed the wax, we put it on our digital scales, and it weighed in at 373 milligrams. I would say that's kind of an average extraction. You've probably seen one of my earlier videos where I exceeded the 1 gram mark, so that was quite an achievement. So I hope you're all keeping well and safe. Yeah, please do stay tuned. I'll upload some more videos in due course. Take care, bye.